We'll just monitor it and see how it's doing. It doesn't seem to be getting any worse. Let's see again in 3 months and see what happens. That's what this patient was told. Was it the right thing to tell the patient? That's what we'll talk about today on Practical Treatment Planning. Patient 72 years old. I look at a tooth. I say, I think that tooth needs to come out. He says, well, is it getting any worse? My last dentist said the things that I just said. Here's the value of a CT scan. This is tooth number 2. Okay, that's the upper right second molar. Way back in the back, just adjacent to where the wisdom tooth would be if he had wisdom teeth. Now I want you to take a look at this part of the tooth right here. This part of the tooth has bone around it. You see this bone right here? And that bone is keeping the tooth in place. So it doesn't seem to be getting any worse. But let's take a look at this part of it. First on the conventional x-ray. And you see this dark area all the way around the tooth? This dark area means that there's an infection in there. Dark is almost always bad on an x-ray. And certainly in a dental x-ray, it's always bad. And what you're seeing here is rather than this white bone, contrasting it to what we just pointed out, this dark area means that it's totally infected. But it's even worse than that. Let's take a look at the CT scan. And now you'll take a look at the root, and here's the root of the tooth. Then you see this dark area. Now you're seeing it in 3 dimensions. And now you see this slight thin shell of white. And then just above that, something that's gray and then something that's dark. Okay, so you see that whole thing. This area of white is the only bit of bone, tissue paper thin, that's separating this infection from the sinus up here. The membrane is this gray area here, and the gray area is actually keeping the infection from going into the sinus. It's the body's attempt to fight off the infection, and it does that by taking the soft membrane, which is ordinarily very thin, and thickening it up a little bit in order to prevent the bacteria from getting into the sinus. Yeah, this tooth is bad. This tooth should have come out a long time ago. And so, yes, we're arranging to have this tooth taken out. Extraction of the tooth will be relatively easy. What will be more difficult is separating out the infected tissue from this thin layer of bone, and that will require some surgical skill, which our surgeon, Dr. Fernando, will take care of right here. So just because it doesn't seem like it's getting any worse, we need to make sure that we're not keeping infections in place that could be damaging not only the mouth, but also your overall health.